get these questions or comments on posts so often that I want to clear a few things up. Hi everyone, I'm Dr. Tiffany, a chiropractor at Liberation Chiropractic and Wellness, and today I want to go through a few questions that I see commonly or even get asked myself as a chiropractor. I am fairly new in practice as a doctor, but I have been seeing patients and taking care of patients as an intern and as a doctor combined now for about 3 years. Before that, I was a chiropractic assistant or CA for about 2 years, and I've been a patient under chiropractic care for nearly 15 years. So I feel like that qualifies me to answer some of these questions, and I have a good repertoire of questions that I've been asked before as well. So I put together a list of the most common questions I get. I may have forgotten a few here and there, but I hope this clears up some of the common questions, concerns, and misconceptions about chiropractic care. This first one is more of a statement and less of a question, but I just heard this one today. A person is afraid that getting an adjustment will break their neck. I feel like this one is a little bit more of a fun one to discuss. A lot of people watch videos of adjustments online, which I've already mentioned don't do. Also see in movies. Movies make breaking a neck look so much easier than it is. And so I'm going to go into one of my favorite statements, and you will hear me say this a lot in the lifetime of this channel. Not all chiropractors are the same. Any adjustment video you see online, the chances of that being exactly how I adjust are fairly slim. There are many chiropractors who adjust just like I do, and I've not seen every video there is to see online about adjustments, but I do know that some of the more extreme ones I've seen online do not represent how I adjust patients. Now, I'm sure there are forceful adjusters out there, and that's fine. That's how they adjust, and there've got to be patients who seek them out for that. But generally what you'll find is that chiropractors use speed rather than sheer muscle to generate the force that creates an adjustment. We're trying to get motion into the spine, not over motion it. But even more comforting is the fact that the joints in the cervical spine are designed to be protective while also allowing us to have full range of motion that we have in the cervical spine, which is more than the other two regions, the thoracic or lumbar regions. In addition to that, the muscles and ligaments in your neck are also a protective measure for your spine. So ultimately, I would say that unless you just have such severe osteoporosis that you can't even stand against gravity without fear of your bones crumbling, you should be pretty safe to get a cervical adjustment. I've even seen people with brittle bone disease get adjustments regularly and safely. And with all that said, chiropractors are trained to evaluate a patient to know that it's safe to adjust them before they ever adjust. So the chiropractor will be able to tell that specific patient whether or not they should adjust them. That brings me to my next statement, which is that someone has been told by their doctor that they can't be helped by a chiropractor, that they shouldn't let a chiropractor adjust their neck or adjust them at all. This one actually makes me a little mad. There is some beef between old school medicine and chiropractic, and I might make a video on that topic later, but I really don't like to talk about it because we do have better interprofessional cooperation today. But long story short, in the 1800s, the American Medical Association, or AMA, led a campaign against chiropractic to eradicate the profession. There could have been many reasons for this. Medical doctors then considered chiropractic pseudoscience, or maybe they didn't want the competition in healthcare. Regardless of the reason, there wasn't much oversight in chiropractic back then, but in the last several decades, chiropractic has worked hard to maintain standards of care, and that shows through chiropractic being supported by insurance now. You can receive chiropractic care and use your insurance benefits. So this whole campaign against chiropractic ended around the 70s or 80s when a Supreme Court ruling stated that the AMA had in fact led a campaign to unjustly eradicate chiropractic. And there's a quote about the ruling that I would like to read specifically. Evidence at the trial showed that the defendants took active steps, often covert, to undermine chiropractic educational institutions, conceal evidence of the usefulness of chiropractic care, undercut insurance programs for patients of chiropractors, subvert government inquiries into the efficacy of chiropractic, engage in a massive disinformation campaign to discredit and destabilize the chiropractic profession, and engage in numerous other activities to maintain a medical physician monopoly over healthcare in this country. That sounds pretty extreme. I have a hard time believing that so many people colluded in such a negative way. Maybe it was led by fear or misunderstanding. Regardless, I'm glad that today there is better cooperation. However, if a medical doctor does tell a patient not to see a chiropractor, I would be curious about several things. First, I would be curious as to why they would say that, because the chiropractor is the expert on chiropractic. So really the chiropractor would be the only person who could determine whether or not you would be a good candidate for chiropractic care. In addition to that, a chiropractor would never tell a patient not to seek out medical care. I know that's kind of a long-winded short version of a story, and like I said, I don't like to get into that because I don't like to point fingers or try to bash one profession in bringing light to another. But I do want to get into the second part of that. That is the idea that a doctor would tell a patient to not let a chiropractor adjust their neck. When I hear that statement, I often just attribute it to the person telling that patient that information doesn't know what chiropractic is or how it works or any of the other information that I'm about to tell you. I'm assuming that the biggest worry when someone makes that statement is the concern for the event of a vertebral artery dissection. And that is a really big deal, and as a chiropractor, one of my worst fears. What happens in an artery dissection is that an injury occurs to the area where the artery is, so we'll say the neck. It is typically a pretty severe injury, like a fall where you fell on something and hit your neck, or even a very severe car accident. That injury results in a small tear in the inner lining of an artery. So the patient will begin to experience symptoms like neck pain or headache. It's usually the worst headache they've ever experienced. But these symptoms will come and go, maybe worsening over days or weeks. And two of those common symptoms, neck pain and headache, are very common reasons why a patient would see a chiropractor. So let's say the tear that started initially was small, and that little flap of tissue has flipped over and allowed for blood to work its way into the lining of the artery. And then over time, that tear, that flap gets worse. Then the patient is saying, oh, I've got neck pain and headache, I'm going to go see a chiropractor. And in a very unfortunate circumstance, sometimes the chiropractic adjustment completes that tear and then you have a dissection. Worst case scenario in this situation is the patient unfortunately dies. But what I want you to know is that chiropractors are trained to be on the lookout for these symptoms. And chiropractors should be doing their due diligence and examining patients whenever they have new symptoms or have had a severe injury. And another thought is that there are other things that could cause the finishing of that dissection. It's not just an adjustment. This is not an adjustment only situation. For example, turning your head to look over your shoulder when you're backing out of a parking spot. That turn and stretch is more than you would get in an adjustment. So keep in mind that a dissection like that is not only isolated to just chiropractic adjustments. There are other things that can cause that to happen, but it's still unfortunate and something we never want to happen. Another statement that I hear pretty frequently is something along the lines of, my brothers, cousins, best friends, stepdad's aunt saw a chiropractor and XYZ bad thing happened. I have heard this more times than I can count. There are very many people who have a story about why someone they know will not see a different chiropractor because of a bad experience with another chiropractor. And that experience sometimes doesn't even have to be related to the adjustment. It could be something they saw in an office, a chiropractor not doing their due diligence, or something a chiropractor said. First and foremost, foremost, I hate to hear of any time when a patient has anything less than a stellar experience with a chiropractor, especially if that experience resulted in injury or death for a loved one. I do my very best every day to make sure that patient care and patient safety is at the top of my list because patients are like family to me. I'm invested in their health, I'm invested in their safety, and I want them to get the best results possible. And you've heard me say it once already in this video, but you'll hear me say it 1,000 times. Not all chiropractors are the same. So the mistake of one chiropractor doesn't reflect all of the other chiropractors who work hard to make sure that their patients are happy and safe. And I know that I can speak for myself and for all of Liberation when I say that patient care and safety is our top priority. One thing to consider about patient safety is my malpractice premiums. This year, for part of the year, I paid about $300 in premiums for malpractice insurance. Next year, that may go up to $1,000 for the whole year. When you consider that compared to the premiums of a neurosurgeon or an OBGYN, my malpractice premiums are a fraction of what they would pay. They may pay tens of thousands of dollars a year in malpractice insurance. There are reasons for this. For one, chiropractic is minimally invasive to the body, so there are very few undesirable outcomes that can happen as a result of chiropractic. You also have to consider that the likelihood of someone being injured as a result of chiropractic treatment is slim, like 1 in 1 million. So you can rest easy in the fact that my goal is to keep you safe, and by design, chiropractic is safe. Another thing I hear is, if I get adjusted once, I might have to get adjusted forever. This one is simply a matter of misunderstanding. Many people, when they get adjusted, they realize that they feel better overall and decide that they don't want to stop getting adjusted. That can often be bad for business because patients who didn't understand the concept of maintaining their spinal health will get adjusted once or twice, feel better, and then decide that they don't need to come back and get adjusted anymore. We even joke at the office that sometimes we're too good at our jobs. So when something as simple as getting an adjustment anywhere from once a week to once every month or so makes you feel better and makes you function better, why would you want to stop? And that's up to you. There's no rule that says you have to get adjusted forever. Okay, we're getting to one of my favorites. So a lot of times people will say to me, well, I don't need to get adjusted because I don't feel any pain. This one can initially be hard to understand because we are taught to look at health a certain way. Growing up, we look at health as I'm fine as long as I don't have any symptoms. And then when I do have symptoms, then it's time to do something to stop those symptoms. And yeah, you may see a commercial here or there about diet and exercise, but let's be real, the standard American diet or SAD diet really isn't doing much for us. Chiropractic looks at health differently. When I see a spine with reduced cervical, thoracic, and lumbar curves, I see a body that's not functioning properly, a nervous system that has tension, and a reduced brain-to-body connection, even in the absence of symptoms. Let that sink in. Your body can be functioning at a level below normal, and you never even know it. That's why it's so important to get your x-rays and see where your spine is, because even not considering the functional aspect of it, when your body's not moving appropriately, then those joints start to degrade and degenerate. One question I see very frequently is chiropractic care covered under insurance? Oh, insurance. It's one of the most expensive costs we have, and it often serves us the least. There are very few cases where I hear of insurance actually being worth the money we paid for it. And that's also a story for another time because it seems to be sometimes a broken system. Obviously, health insurance is beneficial. I'm not telling anyone to go cancel their plans. If I'm in a terrible car accident and need hundreds of thousands of dollars worth of surgery, that's really only when my medical coverage is serving me. I can only be specific to my office when talking about insurance because there are so many variables at play. To be in network with Blue Cross Blue Shield, I had to sign a contract with them saying that I would discount my fees. Then when patients come in with Blue Cross, if they've met their deductible, they can pay either a copay or a percentage of the fee. One thing that is hard is the mentality that if your insurance coverage isn't enough, you don't need care. And it can be infuriating to me that insurance can dictate your care in that passive way. But insurance coverage doesn't change the fact that your spine may be the reason that your body is functioning suboptimally. And the urgency there of taking action on your care can be one-sided. And that's why my office takes part in a discount program called Chiro Health USA. You'll hear us call it CHUSA in the office. CHUSA is a legal way for us to discount our fees so that they can be affordable for patients who don't have insurance coverage or choose not to use their insurance coverage. And there are plenty of people who do that. The way it works is you pay a yearly fee to CHUSA. That fee does not go to our office, it goes straight to CHUSA. They're a separate entity from us. And that gives you and the members of your household access to the discounts that CHUSA provides. It's really nice because a lot of the times paying cash through CHUSA ends up coming out better than your insurance coverage would. And then you don't have to worry about going over the allowed time that insurance wants you to seek care for chiropractic. Yeah, that's a thing. Even though you pay your premiums all year long and have year-round coverage, insurance doesn't like to pay for anything that isn't an acute or new problem. We can discuss that more in the office if you need more clarification. I know that it can get a bit convoluted. And don't get me wrong, like I said, I think insurance has beneficial aspects, but when it comes to chiropractic care, don't feel blocked in or like that's your best option. And also keep in mind that insurance can be a good option for medical care because it tends to be a lot more expensive than chiropractic. But I feel like you'd even be hard pressed to spend $10,000 in chiropractic in 5 or 10 years. Okay, my last and most favorite question for this video is, are chiropractors even real doctors? This one was even confusing for me at one point. I didn't really understand that outside of an MD, anyone else could be a doctor, but many degrees award the title of doctor. My degree is titled Doctor of Chiropractic, and the name's right there in the degree, but I do like to bring to light what that entails and why I hold the responsibility of being called doctor. I mentioned in my introductory video that I hold a bachelor's degree in science in biology from the University of South Alabama, and then I obtained a Doctor of Chiropractic degree from Life University. The Doctor of Chiropractic degree at Life University was designed at the time I went there as a 3.5-year program. But I finished in 4 because I wanted to retain information better. While all chiropractic schools differ, the chiropractic program at Life ran on a quarter system. We would start the year in January with 10 weeks of class and then a week of finals. Then we'd have a 1-week break and then start a whole new quarter for 10 more weeks of class and then another week of finals, and then we'd have a 3-week break for the summer. And then we'd repeat that for the second half of the year as well. So a 1-week break in the fall and then a 3-week break in the winter. That system required me to take anywhere from 20 to 31 credits per quarter. I modified my schedule some, taking some classes early or some classes late, depending on what was going on that quarter. This means that it wasn't unusual for me to have 9 to 11 finals in a finals week. And that's not even including the 3 to 6 or 7 finals for labs that we had in weeks 9 or 10 of the quarter. For the first year, you took classes in the basic sciences like anatomy and physiology, biochemistry, microbiology, and embryology. In the second year, you got a little bit more into the chiropractic sciences, so technique or adjusting classes, and philosophy of chiropractic. In your second year, you also get more in depth in radiology, technique, and diagnosis, and you also start in the clinic system. In the clinic system, you start out with student clinic, where you give care to students as your patients. That lasts for 2 quarters or about 6 months. Then you move up to the outpatient clinic. This is still within the school and supervised by clinic doctors, but you spend 3 quarters or 9 months there. After outpatient clinic, you move up to peak or your externship. This is where you work with a doc out in the field in their own clinic. They've been approved by the school, though, to supervise you adjusting patients and learning for patient care. In addition to the regular course load, you have to take national board exams. These exams are unaffiliated with the curriculum at school, but luckily Life University was a testing site, so I never had to travel for my exams. Many people preferred to study for boards on their own, but I liked to take the board review classes. This means that during board review times, I was on campus from 6 or 7 a.m. until 9 or 10 p.m. You have to fit in your board reviews and patient care in the clinics and studying for your regular classes, obviously, around your class schedule. And that's because the university had an attendance policy that you had to be in class for 90% of the time the class was held. So you could only miss 10% of a class. If a class met 1 day a week for the whole quarter, then you could only miss 1 week. I took 5 board exams, parts 1, 2, 3, and 4, and then physiotherapy. I planned these board exams to occur during school so that I could finish them before I graduated, but it's not a requirement. Some students graduate and then finish their last 2 board exams before they're licensed. After completing boards, I began the licensure process for the state of Alabama, which included fingerprinting for a background check, application, and sending transcripts from South, from Life, and from the national boards. I also had to take a law exam specifically for the state of Alabama. I say all of this not to complain that chiropractic school was hard or took a lot of time, but to ensure you that you're in good hands with me. I took my education seriously, and I take your care seriously too. Okay, if you've made it this far, thank you for listening to all these questions. I know that it's a lot, but I hope that it's helpful in forming your opinion about whether or not you could see a chiropractor. Thank you for watching. If you have a burning question that I didn't answer in this video, be sure to send me an email at drtiffany@liberationchiropractic.com or message me, and I'm happy to answer that in a future video. I hope to hear from you soon.